Good morning, teacher, everyone. I'm going to talk about matrix stiffness and sarcoma growth, the scientific implications of compartments. Definition. A sarcoma is a type of tumor that develops in connective tissue, such as bone, cartilage, or muscle. Sarcomas can be benign, non-cancerous, or malignant cancerous. Treatments include surgery, radiation, chemotherapy, and thermal ablation. Applications in odontology. Approximately 5% to 7% of all osteosarcomas occur in the jaws. The peak incidence of jaw lesions is in the fourth decade, with a mean of 34 years. Osteosarcoma of the jaws most commonly presents with swelling and localized pain. Other signs and symptoms include loosening and displacement of teeth, paresthesia, epistaxis, and nasal obstruction. The average duration of symptoms before diagnosis is 3 to 4 months. The most common locations are the body of the mandible and alveolar ridge of the maxilla. Pros and cons. Pros. Metastasis is uncommon with jaw lesions. Cons. Sarcomas of the jaws do not appear to be radiosensitive and have not responded well to chemotherapy. Patients with metastatic tumors to the jaws may experience bony enlargement, pain, paresthesia, and loosening of teeth. Is to apply in Ecuador. In the period between January 1, 2006 and January 1, 2016, at the Sarcoma Oncological Hospital in Quito, the totality of the clinical histories of the patients attended, limiting the sample to 25,478 patients with diagnosis of oral cancer, and of this percentage, 4,362 persons had sarcoma. The risk of dying is 45%, and the number increases if there is a metastasis. Well, in conclusion, sarcoma is highly fatal, and without the knowledge in the appropriate technological equipment, the dentist can make a bad diagnosis and think that cancer is common mucogingival lesions. Sometimes in cases like in the sarcoma, the ability to resect all metastatic disease completely was the most important prognostic factor of survival.
Very old. We will investigate them, make the right diagnosis, and provide the treatment and rehabilitation services that will provide the optimum outcome for our patients. Sarcomas are extremely rare cancers that develop in muscle, bone, and nerves, as well as cartilage, tendons, and blood vessels, and fatty fibrous tissues. These tumours can spread to other sites, most commonly to the lung, and you may well need tests to investigate this. Your treatment and care is managed by a multidisciplinary team who make sure you receive the right treatment at the right time and in the right place.
Our consultants are among the most experienced sarcoma surgeons in the UK, are internationally renowned, and have been involved in training many countries' leading surgeons. Currently our team includes 5 consultant surgeons who have skills in limb-salvage surgery, bone transplantation, bone grafting, and when needed, amputation. We use the latest technology in prosthetic design and manufacturing. They are supported by senior training doctors, clinical nurse specialists, and a nurse consultant, one of which will be your key worker throughout your pathway. The wider team also includes histopathologists, radiologists, and oncologists.
The hospital team is also supported by a team of administrative staff, including the cancer pathway office, secretaries, appointment schedulers, and managers.
Size for a while, so we were thinking him, we went physical therapy, rehab on it for a year, and it never went away. And then, right before the day that I actually had the surgery to take it out because it was starting to limit my movement, it started growing exponentially within a few days before my surgery. So when I went in, the day of surgery, it was like I had a softball-sized lump on the inside of my thigh. And then they pulled it out, and it was quite large in size. It was over 13 centimeters. It was over 1.5 pounds in weight. And it's sort of the typical sarcoma story is that most of the sarcomas, I guess, when you read about them, they're found through some sort of physical injury, is the way they show up.
Nerves, and other things that don't really have a function in the body other than to hold it together. Any one of these different kinds of cells, fat cells, muscle cells, different types of nerve-protecting cells, blood vessel cells, if they turn cancerous, that type of a cancer is known as a sarcoma. Now, importantly, the different types of sarcomas have more complicated names. So a muscle sarcoma could be either a rhabdomyosarcoma or a leiomyosarcoma. These polysyllabic nightmares are difficult for patients to understand. They're very difficult for physicians to understand unless they are sarcoma experts. And frankly, it's been very confusing in the field of medical research. And part of what our team is trying to do with expert pathologists like Chris Fletcher at the Brigham and Women's Hospital is to try to make these different sarcomas actually different diseases that we treat in different ways. The analogy is simple. If you get an infection, you try to figure out what bug is causing the infection, and then the doctors can treat that specific bug. It's exactly the same with sarcomas. If a patient or a loved one gets a sarcoma, you want to be sure you're getting the exact right type of treatment for that exact right type of sarcoma. Part of what our team here is focused on is understanding all the different types of sarcomas in as much detail as we can, right down to the level of the DNA. Because sometimes, as in the case with the sarcoma known as gastrointestinal stromal tumor, or GIST, the DNA and the mutations in the DNA of the tumor can give us clues as to important new molecular treatments that may be developed to fight that type of sarcoma. When a patient or family member is diagnosed with a sarcoma, there are many decisions to be made very quickly. The national guidelines from the National Comprehensive Cancer Center Network strongly encourage patients to seek an expert opinion at a sarcoma center or a center where the physicians there work as a team and have extensive experience in the management of patients with multiple kinds of sarcomas. The Dana-Farber Brigham and Women's Cancer Center, part of the Dana-Farber Harvard Cancer Center, has extensive experience in our hospitals, and we have an extensive team of multidisciplinary specialists, including medical oncology, surgical oncology, orthopedic oncology, pathology, reconstructive surgery, and many, many other specialties that work together in a coordinated team to help provide the best care for patients, whether it be using standard and conventional measures that local physicians could also deliver, or whether it be in the cutting-edge new research studies that are available at our center. We encourage patients to use this expertise here, and we work closely with other centers worldwide so that we can advance the care and the outcomes for patients with sarcomas so that they can be the best they can possibly be.
That's all. Thank you for your attention.